Know the rules well so you can break them effectively. Also said by Dalai Lama, my favorite quote. It's the basis for Lupus Rebel. So living with lupus has taught me that healing is an inside job. I've written and spoken about the importance of mindset. The root of our stress and problems is our beliefs and thoughts about our situation, in this case, lupus, among other things. You can read the blog by clicking the link below. For example, as a lupus patient, if one has the mindset of victim, they tend to give their power away to the medical authority and don't take responsibility for their health and just rely on the medications. On the other hand, there are those who adopt the rebel mindset and decide to take ownership over their health and do everything to help their bodies heal. Victim mindsets begin to identify themselves as lupus patient and defend their identity with it. Rebel mindsets challenge the limitations of lupus and decide to actively help their bodies heal and get strong. So, complacency versus empowerment. Having adopted both mindsets in my life with lupus, the rebel mindset is so much more liberating and powerful. It simply works to help me to own my health and life. I decided a long time ago that my doctors are guides who manage my sickness. I began to understand their role when it comes to my disease. Relying on the doctors for answers for many years made me realize that the main belief is that I have lupus, or their main belief is that I have lupus, and it's their job to treat lupus. My goal was to limit my need for their services, so I wanted to be well, so I'd never had to visit them again. I became my own experiment for various supplements, diets, detoxifications, exercises, meditation, and various self-help books. I also obsessively studied many disciplines and learned to understand their premise so I can begin to apply them artfully in my life. I learned that the more you know, the more you can bend the rules to make things serve you. So you guys all know about my recent episode. I've recently been in the hospital. The whole time, all doctors considered my lupus to be the underlying driver for my condition. It began with my rheumatologist. He dismissed my condition as a minor lupus flare. Looking back, my labs indicated something potentially far worse. I was treated with standard plan of care, which included corticosteroid tapering dose for 10 days and was sent away. 1 week prior to my visit to see him, he ignored the hot red rash on my face. Is a typical lupus rash and didn't believe I was having fevers because in his office it was normal. I was spilling some protein in my urine since a week ago with the urinalysis, so he kept urging me to go see my nephrologist. I've had 3 episodes of kidney nephritis, so I knew it wasn't my kidneys because I would know the symptoms. And the protein marker was only 2+, which is trace. When one is fighting for infection, some protein in the urine is common also. So he assumed it was my lupus and advised me to take my medications, Benlysta and Plaquenil. I did go see my nephrologist during the day, the very day I was admitted to the hospital, and moved my schedule around that day to accommodate this appointment, only to find out that I needed a pre-authorization from my insurance to see my nephrologist. So I was super mad. My rheumatologist was relying on my nephrologist to do a CT scan as I began to have lower belly aches, vomiting, and cramping. I called him later that afternoon and asked if he wanted to see me because I wanted the CT scan, because I wanted some answers and I couldn't see my nephrologist. But my fever kept spiking and I felt something was terribly wrong and I just felt so horrible. My spouse had enough courage to say, we're just going to go to the emergency room. And I was in excruciating pain, couldn't urinate, fever was super high, and it became progressively hard to stay vertical. So the rest of the story is shared below with my link to my pancytopenia blog that I wrote about. So let's talk about some negotiations I had with my doctors. I was discharged with an unknown condition. I potentially had either aplastic anemia or Plaquenil-induced bone marrow suppression. Of course, the latter would be a godsend. If it was the latter, elimination of Plaquenil will resolve my issues. I was to follow up with a hematologist, infectious disease doctor, and a rheumatologist. It's been a busy few weeks with me running my business and seeing patients and making time for my doctor visits. And my labs began to improve exponentially, that by the end of week 2, my lab values were completely normal. Remember, when I was discharged, my white counts, neutrophils, and platelets were dangerously low. And I was sent home with a PICC line to inject antibodies every 8 hours to take care of the staph infection. My hematologist gave me oral antibiotics called Cipro to protect me since I had no immune system. And as soon as my neutrophil reached 500, I asked to remove oral antibiotics, but it had to be a call I had to make proactively to his office on a Friday afternoon. And so that's something I had to do, be proactive for my health, because the Cipro was making me super sick. Then my antibiotic infusion. I was able to remove the PICC line and stop the infusion 3 days earlier. And with my rheumatologist, he wanted to have me on prophylactic prednisone regimen at 10 milligrams per day. I negotiated it down to 5 milligrams and let him know that I would not stay on it long term. I see him next week, and you bet we'll be eliminating the prednisone. And all this to say that you're involved in your care. You can ask questions and be proactive about what and how you're expected to take the medications. There is no shame in asking questions about your health with your doctor. And if your questions aren't answered in a manner that's satisfying to you, then give yourself permission to seek out another doctor that you resonate with. You are your biggest advocate, so know your rights and know your body. So some of the lessons I learned from this sickness was that I learned that life is fleeting. And when you don't have health, you have absolutely nothing. And doctors tend to over-prescribe medications to cover liability. And medical system is super amazing at sick care, because I would have died otherwise. Trust your gut and listen to your body, and learn to love, laugh, and live joyfully. And you know that we are our best doctor. And my mission in life became so clear, and it's to empower as many of you as possible to take responsibility for your own health. And after a sick episode, get busy healing the body. Gratitude for everything, including the experience, are the lessons that I learned, that I take home. The strength that I gained. I realized how strong I am today thanks to living with lupus. The experiences that I've lived through because of lupus enabled me to have more compassion, humility, love, and empathy and understanding for those in pain. I also realized that what a miraculous body we have. I already feel my body is recovering so fast from this episode and fighting back stronger than ever. And I just am super busy supplying it with whatever it needs to do just that. And I have so much gratitude and love for all of you in my life, and I hope my experience helps you to find your strength to fight just a bit longer and harder to change your beliefs to serve your needs. Again, thank you so much for watching, and I've got amazing programs for you, including the Alkaline Detox Protocol, Alkaline Transformation Lupus. Links are shown below. And as always, please subscribe to our newsletter, our lupusrebel.com, and our YouTube channel, drconniejian.com, and follow us also on social media, including Facebook, Instagram, and Pinterest at Lupus Rebel. I'll see you guys next week.